This is proudly certified that Dr. Shahid Sajjad, Loan, Group 5B, graduated in 2025, has achieved an outstanding performance by securing 224 marks in the FMGE examination on his first attempt. Congratulations. Microphone is yours, please.
Congratulations, sir.
Really happy that I'm going to graduate today. And I remember that I used to be here, like you, as you are together here. Once upon a time, like when I was in first year, I remember the days. The time slips like a sand in the hand. I remember. I think like it looks like not more than a year that that journey finished, and when it started, I don't remember it. It's so fast. Maybe you are in first semester, yes? Second. See, first semester gone, and you will not know that when 5 years are gone, and you have 6th year course, yes? Okay. So let me introduce myself. My name is Shahid Sajjad. Actually now Dr. Shahid Sajjad. So basically, if we talk about the journey here and journey back in India, you know, it's nowadays the FMG exam is not all about the factual things. In reality, basically they are more interested in asking about the basic concepts and the clinical knowledge which you guys gain here. As you know that the schedule the teachers send you, yes, the timetable, the syllabus, it's actually USMLE based, like that WHO recognized syllabus which they give. And in India also they ask from the same things. So what I recommend for you guys, if you come for class, whatever the schedule is, just go for that, search it on PubMed, because they are the official articles there written, and extract the data from that and prepare for the class, and come whatever teacher asks for the questions and all explanation. So read that. What it will happen, like what will happen after like till 3, 4, 5 years, you already see, like in first year some subjects, for example anatomy, in second year you will see clinical anatomy. My teacher, she taught me clinical anatomy, and I think whatever she taught was in exam also in FMG. Okay? Like this will repeat itself. Basically medicine back in India and other places, they say medicine as a not 19 subjects. They say it's a one subject, simply medicine. They don't say anatomy, physiology and all 19. But we divide based on our easiness, so that we can divide it on first year, second year. So they divide it 1, 2, 3. It becomes easy for us to access and study. Okay. Now some students they will say that what if we leave this subject? Okay. For example, it's an asymmetry. If I don't have one hand, how will I look? For example, medicine is all about that. That's why it's divided in anatomy, physiology like this. And what for you guys the approach should be, which I did, I will suggest that basically you start from the basics like anatomy, physiology, go on. And you are not computers, I am not a computer, no one will remember. Maybe today you study something, for example, you study anatomy, any topic. Tomorrow you will see, who is this topic? I don't know about it. You studied it before, but you will forget. It's the human tendency to forget, okay? But the subconscious mind would have retained that thing. Means, in exam also, your conscious mind doesn't grow. It is so much anxiety is there in FMG exam. So much anxiety, but whatever you have gained from last 5 years, that will help. That subconscious mind will tell you, this is the option, this is the answer. Okay? So, I would suggest go through the subjects, like, there are so many online platforms, PMGC. I will not suggest whatever you like, you take, go with the videos, okay? For example, there is, you are studying anatomy video, take at least 2-3 hours per day, enjoy, to go with friends, go with here, there, everything, play sports, no problem. But align yourself with that proper schedule. Like, okay, in day I have to be at least 1 or 2 hours for myself, for studies. Not only for the studies which you are doing here, for the FMG back. And maybe for you guys, maybe, I don't know, there will be next exam or something. We don't know. So prepare for that. Once you study, for example, anatomy, you will, when you finish it, you will think, I don't remember anything after finishing subject also. Don't go back to that. First of all, you should finish every 19 subjects just by reading videos, watch videos, finish 19 subjects. Then your mental attitude will develop that, okay, once I have gone through it. I will give a simple analogy. For example, you meet me today, okay? You said hi, I said hi. That's how you have to approach your subject. First, go, hi, hello. That's it, with the subject, okay? Later on, when you finish 19 subjects, maybe it will take 1 or 2 years. After that, it will take maybe only 1 year. What you do again, go say hi, hello, how are you, what are you doing, okay? And third, when you do third revision of the videos only, okay, then you ask his name, what are you doing, let's go for party. Do you understand me, what I want to say? Yeah, simply, it's gradual thing. You can't remember everything in one go. You will study anatomy and you will say, I forget everything, I don't remember now. It's tendency, our teachers also forget, we also forget. Even I passed by FMG back now, even maybe I will also forget the things. Maybe I have forget 50% of that, because it's not retainable, okay? But the crux, whatever I am saying here, you should know the crux of it. I maybe spoke maybe 100 lines till now. If I ask any one of you, tell me exactly what I said, maybe you can't see it, yes? So what you can say, what was the crux of my all this discussion? But you can ask, you can tell me that thing, yes? Do you get me? Same examiner is asking. He will not ask every bit of it. Examiner, what he wants? He wants that do they know the basics? Do they know the crux of the all medicine? Okay. Now, if here is anyone for fourth year or final year, for them, I will suggest that you have now less time. Time is not enough. You need to go fast. You need to whatever notes you have. I'm not saying you mug up that. No need to mug up, because back in India, you will find the sources which are concise. Like, there are so many coaching platforms. I also went to one of the coaching platform. What they give, if you see today, for example, your peptide or marrow and all, they give notes maybe for anatomy, maybe it will be 1,000 pages. Yes, it's for basic to become a doctor. But to pass the exam, there is a different strategy. They will give you maybe 200 pages of anatomy. Okay, so how easily you can revise it? Maybe 2-3 times you can study, you can revise. I revised it maybe anatomy 8 times in these 6 months which I was there. Why? Because they are concise notes, they are well structured, they know what is the high yield topic. Okay, so for that you have to research by yourself. For example, I went to one of the academy, it was Arise Medical Academy. I researched about that before, like what is best for me. Okay. And back in India, there are two things which you have to see. One thing is hard work and smart work, okay? And another thing is that which platform makes me do hard work, or which platform makes me do smart work. So this thing, it's based on your preference that time when you will reach. But for now, you just need to focus on your basics. Do you get me? If anyone have any question related to like how we, if I miss anything for your end, you can ask me like when I started my preparation and which platform I use or what I wanted to say. If I miss anything, you can ask anyone. Okay. So her question is that when did I start my preparation exactly? Listen, as we all are here, we couldn't qualify the NEET UG exam, yes? And it's something that black mark on us, we feel inside that we couldn't do it or something like that. So basically that thing was in my mind always. My father used to say me that no issue, now for like equivalent to NEET UG, we have the FMGE exam because it makes us equivalent to Indian medical graduates, yes? So that should be our motivation first. You should not ask me that when should we start the preparation. We should start preparation when we do admission in our state university only, okay? Yeah, but I started in my first year only. There were Dr. Najib's lectures were there online. Yeah, we used to study that because it gives a broad concept of understanding the subjects. So I started from there. Then I took one of the online platform, and maybe till final year I revised it. I reviewed the videos. I think 4 or 5 times of all 19 subjects. No, 18 subjects except PSM because it was a little bit dry for me, and the guidelines changed for community medicine. So that's why I took it at the end, very end. In my final year, I studied that. And the approach was same, which I said, come for the teachers, whatever topics they give, study that because it's beneficial. You study, for example, upper limb now, you will study about its nerve supply in surgery also. You will study clinical anatomy also. You will study it in the plastic surgery also. So it will again and again it will repeat. Don't think like that. For example, 3 years gynecology will be for you guys. Gynecology, pediatrics, medicine will be for 4 years from second year onwards. Yeah, I think. So same topics will be, the domain will be same, but the little bit concepts will be getting added up. But if you study from basics, then you will understand it. You understand me? Because the subject, the curriculum here followed, it's WHO recognized. Okay, it will help you pass if you study that, only that also. It will let you pass the lab, USMLE, Australian Medical Council, everything. But for FMG, the strategy is different. FMG is not all about the hard work only. Okay, most of the students fail. I will tell you the harsh reality of FMG exam. When I went there, I saw my seniors. When I came in my first year, they were in 6th year. Okay, so imagine, when I went back to India, I saw them besides me preparing in the library. I was thinking maybe they are doing PG or something else. When I asked, he said, it's my 12th attempt, it's my 10th attempt. And not one person. I think in library there were, at least if 300 people were there, 150 plus were seniors. Do you understand? If in this lecture hall 300 people are here, for example, among 300 maybe only 10 or 12 people are passing. Do you understand the harsh reality of FMGE exam? It's not an easy exam, it's not a difficult exam. It's a strategic exam. There is another strategy for this exam. Okay? Most of the students fail because they think we are gems. They think we are so much intelligent. Not intelligent people, it doesn't work for that. It has a proper strategy, which I told you. You become a doctor first because your parents send you for becoming a doctor, not to just pass the exam. Okay. Now I will give one last analogy for you guys. I hope you can understand it properly. Okay. Take an example of 20-liter bucket. You know, it has water inside, and think like it's all the medicine, 19 subjects. Okay. What you have to do? You have a 20-liter bucket and think about 2-liter jug which has 2-liter water inside and a 200 ml of glass. Besides, 3 things are there. Okay. This 20-liter of bucket, it's for you for 5 years. For you have to utilize this for 5 years. How? You will use jug and then you drink water from the glass. Yes, you take the sips. So automatically, till 5 years, you are practicing this thing. You are taking the jug, you are putting the water, you are using that knowledge. This all knowledge for 5 years because it can't be concised in 6 months. Yes, you need this basics of practice which you have done in the last 5 years. After that, what you are doing? When there will be last semester for you, like 5.5 years completed, you need to take from this jug only. you don't need to use that bucket because already you have practiced a lot for that. You have gained enough knowledge to become a doctor. Okay. Now, when you go back to India, okay, there is something different strategy. What? Because you can't even revise the JAG. You have to revise at least one subject for maybe 6-7 times minimum. You can't revise it. Why? Because time is less and you will not get enough time there. The same issue happens with our seniors. They think, okay, we can do in 6 months or maybe last year we will study. It will be easy. Do you think this one bucket, we are not able to finish that jug, how can we finish that whole bucket? Do you get me? Now what will happen in India? If you already finished with the jug, if you already finished with the bucket, there will be some coachings. They are actually the best faculties, best teachers, like best doctors from AIMS, from JIPMER, for all them. They have so much experience, 30 year plus experience. These professors are there who actually teach us or how to crack the exam. And they will give you just this glass, and this glass will contain 80% of the bucket. You understood the massiveness of that glass. It's simple to use because you already drink from that glass from 5 years, yes? And they will give only that glass to you, which is 80% of the whole 100%. How easy it becomes. So this is something which you should think about. But this glass will be easy for that person who already have studied before, who has not only gone for cricket, football here and there. Okay. So I think for you guys, this is enough. I feel from my side. And still, if anyone have any question related to FMG exam, I told the harsh reality of this. The passing percent is so low, 9, 10%, 20% maximum. This time it was 24. That's good. But still, you need to focus. You need to focus, guys. Maybe your time it will be next exam. Next exam. You know, next. Yeah. Anyone have a question? No question? Okay.
What kind of books do you use?
Okay.
I have some question with you.
Okay. I know you guys are confused how to study, yes? Related to books, material use. I forgot to mention that